Hi, this is Christiana Weigand, and this is my final exam submission for diagnostic reasoning and advanced physical assessment. Okay. Knock, knock, knock. Hi, Mr. Strictly. I'm Christiana. I'm washing my hands. I'm a student nurse practitioner from Northern Kentucky University. Can you tell me what you're here for today?
Just a wellness checkup.
Okay, we can do that. So can you give me your name and date of birth?
William Judge Strictly, 08/02/1972.
Great. And can you tell me what year it is?
2019.
Can you tell me where you are?
I'm in Erlanger, Kentucky.
Okay, where are you right here?
Physician's office.
Okay, and who's the president?
Trump.
Wonderful. Okay, so I've determined that Mr. Strictly is alert and oriented ×4. We're going to take a quick temperature for his vital signs. So that is 98.7. We're going to check his pulse here. And also note his respirations. So I'm going to say that that is a pulse rate of 72 and respirations of 16. Let's go ahead and get a blood pressure for you. Here we go. Oh, sorry. What does your blood pressure normally run, Mr. Strictly?
Around 120s to like a mid-high 70s.
That's the way I wanted it. There we go. Okay. 120s to 170s. All right. Okay, 120/78. 122/78, excuse me. All right, so Mr. Strictly, the first thing that I would like to do in our head-to-toe assessment is just take a quick look at you. Your head is where we're going to start. It looks normal cephalic. It is a normal shape. I don't see any asymmetry in your face, no drooping of any facial features. Eyes look symmetrical, ears look symmetrical. Do you have any concerns or complaints you want to discuss before we begin? Okay, so first I'm going to palpate your head, okay? And I'm looking for any sore spots, bumps, lesions, any infestations. Any pain when I do that?
Not at all.
Okay, good. So we have normal hair distribution, no lesions or lumps noted. As I said earlier, normal cephalic. Wonderful. Let's go ahead and check your eyes. I see that you're wearing glasses.
Yes.
So this is a Snellen and eye chart. If you would be so kind, I'm going to stand 6 feet as it directs me to. Can you read the lowest line with one of your eyes, please?
LTFPH.
So that's 20/20 in that eye. And the next eye, sir?
LTFPH.
So your corrective lenses are doing their job. Because that is 20/20 in both eyes. Well done. May I remove your glasses, or would you remove your glasses for me? Thank you. So I'm looking at the eyes right now. The sclera are white. The pupils and the irises are symmetric. I'm going to say the pupils are 3 to 4 centimeters right now. It's a little dark in here at nighttime. I'm going to touch your eyes and kind of pull down here. The conjunctiva are pink and moist. Can you look down for me? Yes, and the sclera are definitely white. I see no signs of infection or any kind of drainage. Looks good. I'm going to take a little closer look with our otoscope here. First, I'm going to check your pupillary reflex, which is intact. Good. Reactive. Good. All right, and then with our otoscope, going to be looking at your red reflex, which I see, and then the disc is a pale pink color. The cup looks to be appropriately sized. Check over here. see the red reflex. And then, yes, once again, the cup, or excuse me, the disc is a pale pink color, and the cup looks to be approximately the same size as the other eye, which is an appropriate finding. While we're looking at your eyes, we're going to check your, they're called the cardinal gazes, 6 fields of cardinal gaze. So I want you to follow my finger with only your eyes, all right? So this way, here, 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 and here. Well done. Then I'm going to take my finger and bring it to your nose. I'd like you to follow it with your eyes, please. Okay. So I'm going to say we have perla here. Pupils are equal, reactive to light. We have accommodation. Looks really good. So you can put your glasses back on if you'd like.
Thank you.
So I'm going to take a look at your ears. Any problems with your hearing? No? Any pain when I do that? I'm going to do a whisper test. See if there's any issues undiagnosed with your hearing. So I'm going to whisper something. I'd like you to repeat it. Okay?
Wasabi.
Happy children. Oh gosh.
Happy children.
That's right. Happy children. Okay, so now I'm going to take a look inside your ear here. Okay. If this were a patient in an exam room, I would not use the same instrument or the thing I have dropped on the floor. All right. So I'm going to pull up and out. Normal structures noted. Tympanic membrane is pearly gray, no bulging, no inflammation noted. Once again, up and out. Normal structures, pearly gray tympanic membrane. Was that painful at all when I did that?
Not at all. No pain at all.
Wonderful. So we're going to do a couple other tests to check your hearing. The first is the Weber test. I'd like you to tell me when you stop feeling the vibration, or excuse me, no. I want you to tell me if you hear or feel the vibration equal or larger in one ear or the other. Okay?
Is equal.
Okay. And then the Rin test, I'm checking to see if bone conduction is different than air conduction. So you've done this one before.
Stop.
Okay.
Stop.
So air conduction was definitely longer on the left ear, so that is the response that we want in the Rin test. Same thing over here, Mr. Strictly.
Stop. Stop.
Okay, all right. So once again, air conduction is longer in the right ear, which is also a response that we would want to see. All right, so I'm going to do a couple more exams to check to make sure neurologically you're intact with your cranial nerves. I would like you to lift your eyebrows up for me. Good. Can you frown? Smile. Clench your teeth. Stick your tongue out. Squint your eyes. Can you shrug your shoulders? Good. Let's check range of motion in your neck. Can you move your head back and then down? Side to side? Ear to shoulder? Ear to shoulder? Beautiful. Well done, Mr. Strictly. Any pain when we did any of that? Wonderful. Have you had any problems with your nose or your sense of smell? Okay. Just going to palpate your nose here. Any pain when I do that?
Not at all.
All right. So just looking down here, your septum looks intact. Can you breathe when I do that? Can you breathe when I do that? Good. Okay. So taking a look in here. So turbinates appear, sorry, clear, no drainage, no irritation or erythema noted. So they look normal. Good. And you said you haven't had any problems with your sense of smell. How about your mouth? Any issues with teeth or sores in your mouth? No? Okay. Can you open and close for me? Any pain when you do that?
No.
All right, so I'm going to take a quick peek inside your mouth here. Let's see. So oral mucosa is pink and moist. We have good dentition, no missing teeth. Can you stick your tongue on the top of your roof, or the roof of your mouth? So the underside is pink with good vasculature, no sores that I can see. You can put your tongue down now. All right, I'm going to do the standard doctor test. You say ah for me. Good. Okay. So the hard palate was whitish and intact. When Mr. Strictly vocalized for me, I was able to see that the soft palate and the uvula rose, which is the response that we want, and the uvula was midline. There was no exudate or inflammation in the tonsil area, and Mr. Strictly is not complaining of any throat pain or recent infections or frequent infections.
Not at all.
Good. Right, so we're going to assess now your lymph nodes. So we're going to start here with your submental, submandibular, preauricular, postauricular, deep cervical chain, or excuse me, cervical chain, yes, occipital. We have a jugulogastric here somewhere. Then we have the superficial cervical chain and the deep cervical chain. We also have some supraclavicular. Any of that painful when I did that? And I did not notice any bumps or enlargements there. Good. Well, I'm looking at your throat. I do see that your trachea is midline. Any problems with your thyroid at all? Okay. Can you swallow for me? Good. Painful at all for me to do that?
Not at all.
All right. Wonderful. Thank you. So now we're going to take a quick listen to your carotid arteries. It's good if we can feel them. We don't want to hear a nasty sound called a bruit, which could indicate turbulence. So I'm going to listen with the bell. Sorry. Okay, here we go. I want you to take a deep breath and hold it. Okay, you can let that out. Deep breath, hold it. And you can let that out. Wonderful. Okay. So I did not hear any bruits when I was listening to Mr. Strictly and his carotid veins checking for bruits with the bell of my stethoscope. Now, Mr. Strictly, I am looking at your chest and your respirations. You appear to be relaxed. Normal skin color and skin distribution. There does not appear to be any pulling or retractions or increased work of breathing. I'm going to go ahead and just touch and see if I can feel for something called crepitus, which is air trapped under skin. Any masses. Any pain when I do that?
Not at all.
Okay, good. So, oh, I'm sorry. I need to percuss as well. So, what we want to hear when we percuss in this region is resonance. We do not want to hear any dullness, because that could indicate a consolidation or something that we hear over a solid organ. That's not something that we want. So I'm going to go ahead and listen to your chest now. I'm going to listen to 10 spots anteriorly, 3 spots on the right and 2 spots on the left for the 3 and 2 lobes. So normal breathing in through your mouth. So breath sounds are clear bilaterally. Good. All right. You can put your arm down for me. Oh, can you take a big breath in for me, Mr. Strictly? So, our respiratory excursion, our lung excursion does look to be appropriate. I'm going to go ahead and any tenderness or pain back here. Okay, great. I'm going to go ahead and once again, what we're looking for is resonance. We don't want to hear any dullness or feel any dullness. And that is what we have here with Mr. Strictly. Very good. I'm going to listen to your lung sounds back here. Back here, Mr. Strictly, I'm just going to any pain when I do that?
No. Not there.
All right. So breath sounds were equal bilaterally. I did want to check for something called tactile fremitus. So I'm going to put my hands on your chest. I'd like you to say the phrase 99.
99. 99. 99.
Okay. Same on the back.
99. 99. 99.
Okay. So normal tactile fremitus. That all appears to be in order. And earlier I wasn't sure if I said I have 8 sound or 8 listening spots anteriorly, 10 sounds posteriorly. I think I might have gotten that mixed up. Okay. So now I'm going to listen to your heart. We're going to start apical, or excuse me, I always do that, aortic, pulmonic, pulmonic 2, tricuspid, mitral. Also want to palpate for the point of maximal impulse, so we're at the mid-clavicular line. 1, 2, 3. So right around there. So just normal breathing for me. So I'm hearing S1 and S2. No extra sounds, no adventitious heart sounds. Good. Okay. We're going to have you lay down here in a second, Mr. Strictly, but first I'd like you to extend your extremities for me, your upper extremities. So warm, to the touch, dry, normal hair distribution, normal hair color, or excuse me, normal skin color for his ethnicity. We have brisk capillary refill, and we have profile sign of less than 160, which indicates no signs of, of clubbing. Can you extend your arms up for me, Mr. Strictly, and out? Can you make like, good. And can you hold your arms out for me again? For 5 seconds. Very good. Any pain or discomfort when we did any of that?
No.
Okay, wonderful. So if you could go ahead and lay down for me, Mr. Strictly, that would be great. Okay. Let's see here. So I am looking at the abdomen in profile. There is some rounding. There is some normal respiratory movements in his chest and his abdomen. I do also see some slight aortic pulsation or pulse there, which is normal. I do not see any signs of jugular vein distension. All right, Mr. Strictly, I'm going to take a listen to your abdomen. So I'm going to listen to all four quadrants, and hear bowel sounds. Yes, your tummy is, I'm going to say bowel sounds are normal. Listen here with my bell. Okay, so I do hear like an aortic pulse. Good. So I'm looking here from this angle. Once again, I see rounding, everything looks symmetric. I'm looking at Mr. Strictly's lower extremities. They are warm to the touch with normal hair distribution. Skin color is appropriate for ethnicity. No edema. I'm gonna palpate his pedal pulses here. And those are 2+, normal rate and rhythm. So posterior tibial. Those two are 2+, normal rate and rhythm. Mr. Strictly, can you push down with your feet? Good. And can you push back up against my hands? Good. Can you lift one leg for 5 seconds for me right there? Good. Can you push down on my hand? Can you push up? Good. Can you lift this leg for 5 seconds for me? Good. Can you push down? And can you push back up? Good. Very good. All right. So, you know, Mr. Strictly, recently the things have changed in terms of colonoscopy. They want men to have those, or people to have those now at age 45 and on. So that's something I'd like you to think about getting. Do you think you could go ahead and sit up for me again?
Yes.
Oh, you know what? I'm so sorry. Could you lay back down? I forgot to palpate your abdomen. Okay. So first, we're going to. We're looking for resonance over gas bubbles, gastric bubble or air in the abdomen, and dullness over the organs. Oh, I already did that, I'm sorry. So now we're going to do light touch. Tell me if anything's painful, please, Mr. Strictly. Now I'm going to touch a little more firmly. Not feeling any masses. The skin appears normal. I'm not feeling any splenomegaly or hepatomegaly at all. Okay, now Mr. Strictly, if you would sit up for me, please.
Sure.
Wonderful. I think what I'd like you to do is come stand up for me. Get this out of the way. Oh, do you need this to hop down? My bad. Okay. So what I'd like you to do for me, Mr. Strictly, if you could you walk from here to the couch just with your normal gait? And when you return to me, can you please walk heel toe like this?
Yes.
Good. Now I'm going to do a Romberg's test on you where I'd like you to close your eyes, stand with your feet together, and try to maintain your balance for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. Well done, Mr. Strictly. Did you have any dizziness or did you feel unsteady at any point with that? No. Okay. So I'd like you to go ahead, if you could, and turn over. Let's see, we could use bend over at the waist for me. I'm going to palpate the spinal processes here. Everything looks symmetrical. Skin is warm and dry. Once again, normal color for ethnicity. Good. Everything looks symmetrical. You can come on back Okay. Let's see. Oh. Okay. One more thing. If you could hop back up here on the table, Mr. Strictly. I'm going to check your deep tendon reflexes. All right. So just lay your arm comfortably right here. Get that tendon there. Good. All right, and then over here. Oh, I hit you. I'm sorry. You okay? Okay, good. Now I'm going to do the same thing with your knee here. And over here. Let's try again. Ow. You got a little movement there. Okay, good. Then I'm going to check your reflexes here. So I'm just going to draw a J on your foot here. There we go. So he's kind of ticklish. And that is a normal Babinski response. In an adult, you do not want to see fanning of the toes with the Babinski. That would mean that things were not good neurologically. All right, Mr. Strickler, I'd like to thank you for your time today.
Thank you.
Thank you.